clinical experience does not have to take place in a clinical environment, meaning the OldPremeds podcast, session number 293. Welcome to the OldPremeds podcast. My name is Dr. Ryan Gray, your host here every week, where I take your questions directly from the non-traditional pre-med discussion over at premedforums.com. And this week we have a good question, a question that comes up so often that we actually bought a domain name, isitclinical.com. And we haven't done anything with that site yet, but we are very interested in building out a whole kind of algorithm where you can go, I'm doing this, and I'm doing this, and I'm doing it here, and this is what I do. And it will hopefully tell you, is it clinical? Because that's the question today. Is this thing that the student doing, is it clinical experience? And it's such a hard question to answer because it doesn't matter where you're doing it. It matters what you're doing and who you're doing it with. Before we jump into that, I want to talk about the MCAT Minutes brought to you by Blueprint MCAT. If you are taking the MCAT, which you all are, I think, then you should be signing up for a free Blueprint MCAT account over at blueprintmcat.com. One of their newest free things over at blueprintmcat.com with their free account is their spaced repetition platform of flashcards. Over 1,600 flashcards expertly created by the MCAT team over at Blueprint MCAT to help you memorize the information that you need to know to do well on the MCAT. That is how to do well on the MCAT as soon as possible. We're seeing that students earlier and earlier and earlier are signing up for that free account so they can start using those flashcards immediately. Go over to blueprintmcat.com and sign up for that free account today. So let's jump into our question today. Our student asks, is passing medication in a children's home clinical experience? They say, I work at a children's home, and one of the responsibilities I have is passing medications to the residents. Would this be considered clinical experience? Now, I want to also read the answers. I usually don't read the answers to you, but a couple of people chimed in. They said, this, in my opinion, is most definitely clinical experience. And then another person said, if you are interacting with patients in a clinical setting, it is clinical experience. And I wanted to read that last answer specifically because that is one of the biggest myths in this whole kind of arena of is it clinical or is it not? The interaction does not have to take place in a clinical setting for it to be clinical experience. Now, I don't know if this person was specifically saying only clinical experiences count as clinical, or clinical settings count as clinical experience. But just the way that it was worded, I just wanted to point it out. Clinical experience does not have to take place in a clinical environment, meaning a hospital, an outpatient center, whatever, right? A doctor's office. Clinical experiences can happen in a home, right? If you're a caretaker of a loved one, or you're getting paid as a CNA to take care of someone in a home, that's clinical experience. That's not a clinical setting. That's just clinical experience. So we have to change our view of what clinical experience is in terms of clinical settings. Because wherever interactions with patients are taking place, that makes that area a clinical setting. So again, no matter where you are interacting with patients, that is a clinical setting. It doesn't have to be this traditional idea of hospital, doctor's office, outpatient center, whatever. Clinical experience is interacting with patients in some sort of meaningful, clinical-ish way. Right, and I always have the pushbacks and the arguments of, well, what about working the front desk? Working the front desk is an admin experience, not clinical experience. Well, what about doing patient registration in the emergency department? I'm interacting with patients. I go into the room, I talk to them, blah, 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 blah. That is an analogous to working the front desk, right? It's an admin experience. Well, what about working a pharmacy tech job at Walgreens or CVS or Rite Aid or wherever, right? That is a retail job. Again, you happen to be interacting with these people who take medications. I wouldn't call them patients. I would call them customers. So you have to be very pragmatic, if that's the right word, around what you call clinical experience and what you don't. If you are interacting with these people in some sort of clinical way, not from an admin perspective, not from a retail perspective, then you can call it clinical experience. So handing out medications is some sort of clinical-ish job, right? You're handing out medications. But then you parse out, well, this is a children's home, right? It's not a hospital. It's a children's home. You go, well, Dr. Gray, you just said clinical. The setting doesn't matter. That is true, right? This is clinical experience. Handing out medications in a children's home. Very analogous to handing out medications at a nursing home to residents of a nursing home. That is clinical experience. Just because we don't typically think of nursing homes as clinical environments doesn't mean clinical things aren't happening in that environment. And remember, the environment itself does not define what it is. And so I'll say just now that the handing out medications in a nursing home is clinical experience. And people will hear, oh, being in a nursing home is clinical. And then they'll go, well, I work in the kitchen at a nursing home. Is that clinical experience? Or I help serve food at a nursing home. Is that clinical experience? Or I help with game night, the bingo night at a nursing home. Is that clinical experience? The answer is no, right? You're not interacting with a patient in some sort of clinical-ish way. And then people will push back and they go, well, Dr. Gray, if playing bingo with the residents is not clinical experience, why do you say child life is clinical experience? Right? Child life, if you don't know, child life is a department in hospital settings, typically hospital settings, where there's someone to come and be with patients, typically pre-procedure, post-procedure, around difficult conversations, to keep a child happy, to distract them sometimes from what's about to happen, from what just happened, from conversations that the doctors and parents are having. Child life is interacting with that patient in a clinical-ish setting. I think child life is clinical experience. There are some adcoms out there who don't. Big picture, when you pull back, you have to understand that there are people behind the admissions committees. There are people reviewing applications. And it's up to those individuals and how they potentially read your description to go, yeah, that's not clinical experience. But Dr. Gray said it was. Well, maybe you wrote about it wrong. I've seen way too many clinical experiences where somebody says this is clinical experience and the description says the majority of my job was spent stocking shelves. Well, that's not clinical experience. You happen to be in a hospital, but that's not clinical experience. So at the end of the day, like a lot of the application, there's a lot of discretion that is needed, right? Use your own judgment. Think about what you do, not necessarily where you do it, but what you do and who you do it with. And use your own discretion and call it clinical or not, based on a lot of the things that we talked about. And hopefully at some point in the future, we'll have isitclinical.com up and running so you can go and kind of click some buttons and go, yeah, that's clinical. No, that's not. Hopefully that was helpful. This is a long discussion around clinical and not clinical. It's such a common question to be asked because finding clinical experience for some people is really hard. And so they will find something that they're finally able to get an interview at. They finally get that kind of offer of a job or a volunteer position. And then they get into the position and they go, well, shoot, like this doesn't seem like it's clinical experience. And they'll come ask, right? Is this clinical? So hopefully if you're in that situation, it is clinical. If it's not, that's okay too. If you don't like it, quit. Go find something else that you'll like more, that will count as clinical, and go enjoy yourself. But remember, you can enjoy stuff that's not clinical too. Just make sure you get that clinical experience as well. All right, it's a big tangent there. Hopefully that was helpful to help you understand kind of the thought process behind, is it clinical or is it not? Hope you have a wonderful day. We'll see you next time here on the Old Premeds podcast.